always interested in learning and growing. I've actually had a few interviews myself, and I've interviewed some SLPs, but I really am interested in hearing your story, what schools look like in Lebanon, all of that great stuff. So let's get started. So everyone out there who is not following me and does not know, I am Dr. Lauren, and I run the Think Dyslexia account, and I am a special educator. And I am not an adult with dyslexia. However, I am neurodiverse. I like to always throw that out there. I was diagnosed with ADHD at 21. So I think that kind of gravitated me towards, special ed. So this is really like a passion and expertise of mine, considering that I started my career in a private dyslexic school now 11 years ago. So
yeah,
here we are. So Maryam, would you like to introduce yourself and tell us a little bit about who you are?
sure. So my name is Miriam. I am an SLP by training. I'm originally from Lebanon. I'm actually half Lebanese, half Russian. But I grew up in Lebanon most of my life. And then in 2017, so actually, I'm going to give you some context. So I did my undergraduate in SLP in Lebanon, and the way it works there is kind of different. I'll also give our viewers some background on that. So the way the field is kind of new. Special education is relatively new as in it's been there like for 30 years maybe now.
Wow.
But you can think in the scope of, research and other contexts, that's a young field. So for SLPs, you do 4 years of undergrad and you do your clinical work during the 4 years. So you start observing since your first year, and then you do several rotations throughout. So basically, when you graduate with your 4 years of undergrad, you are certified to practice as an SLP. So I did that, had various experiences that I enjoyed. I would say I had mostly school-based experiences and early childhood experiences, and this is what I stayed faithful for even now. And after doing that and practicing for a year in the schools, and we'll talk more about that now, but I kind of felt frustrated because of the lack of research and of the lack of tools that you have. As I said, the context, it's a young field, and we didn't even have masters in SLP at that time because the professors that were teaching us were not even, we didn't have people who are qualified basically to give you a master's degree or even a PhD at the moment. So
wow.
Huge need, a lot to do field-wise. So I thought, okay, I need to do something more. I applied for the Fulbright scholarship, and I was very happy that I was awarded the scholarship in 2017. So I came here to the U.S. to UW-Madison, University of Wisconsin-Madison. Yeah. I really loved my time there. It's a great school for speech pathology. Super cold. Did not enjoy the cold in Wisconsin. That was definitely a change. But I did my master's there. One of the great experiences that I enjoyed there was a LEND program. It's a training program for people. It's basically an interdisciplinary program where you have people from special ed and OT and PT and even doctors train basically to help work with people with neurodevelopmental disabilities. So that was a very cool and eye-opening experience. I learned a lot from, a team approach. And that got me interested in early intervention, which is what I'm interested in right now. And as a summary, I kind of ended up at the University of Georgia, where I'm doing my PhD right now. So that was like a very quick tour on how I ended up here.
Yeah. So I think you definitely touched on a lot of things. I don't know how well versed our audience is. I do see some SLPs who have joined. I feel like they are your followers too, because after these flyers went out, I got some followers that were on your page. So I think this is awesome. So those of you who are not SLPs, speech language pathologists, or understand what an SLP is, it's definitely, I feel, at least in the American schools, a lot of folks don't realize just how intense it is to go through a program and to understand the science behind, and there's also so much that an SLP can do. They're not just in schools, they're everywhere. So I like that you kind of gave a nice summary to your journey, your experiences. I do want to say that I have turned on my badges for this conversation. So if anyone is loving this conversation and wants to donate anything towards Think Dyslexia, I would love your support. So I definitely want to talk about UGA. So I actually UGA is in Athens, right?
Correct.
Right. And I used to always get it confused. I lived in Atlanta for a few years, and that is Georgia State. So you're in a PhD program. So tell us a little bit about what your program, like, what is your, what's going to be your research topic? What's your degree going to be in? You know, I always love talking to other women who are seeking or have their doctorate degrees. So tell us a little bit more about that.
Sure. Yeah. And you have your doctorate too. So you know like how
I
the
do.
experience goes and that it entails a lot of work.
There's the degree.
Awesome. So your doctorate is in special ed too, right?
No, actually it's not. And my doctorate is actually a doctor of education. So it's an EDD.
Okay. Yeah.
And it's funny because my doctorate is in teaching, learning, leadership, and curriculum. And my topic was actually on sensory integration for students with autism at the secondary level. Has nothing to do with dyslexia.
Well, that's the awesome thing I feel in our field too. You get to work with, you know, different groups of people, and your interests kind of change and evolve over time, and that's okay.
Right.
Like, I feel that's the nice thing. We get trained to do a lot of things, and then we can, you know, switch up based on what happens in life, I guess.
Right, so, right.
Because I would say during my master's, I felt that I was also inclined towards working with people with autism. It was like a passion of mine for some time, but I feel my interests have shifted over time too. That doesn't mean like I don't appreciate the experiences that I had, but you know, things change sometimes.
Yeah, definitely.
You go with the flow.
Yes.
So speaking of that, so I'm currently starting my third year of my PhD program at UGA. I came in because I was interested. My advisor works, her name's Dr. Jennifer Brown. She works, she does research around early intervention and parents implemented intervention. So coaching parents early on how to, you know, give support for language development for their younger children. So that was my initial area of interest. And if I want to describe like a broader umbrella, I would say I'm interested in language development in children and disorders in general. One particular area I'm interested in would be developmental language disorders. So children who have language disorders in isolation of something that's more medical or a syndrome. So basically you don't really have a clear cause of why they're having this language disorder, but they end up having these, you know, delays and things that are affecting their understanding and expression of language and its use. So when we think about language, of course, reading and writing are one of the areas that you use language for, especially in the school setting. So I would say that's definitely a secondary interest of mine. And it kind of grew because UJ gave me the opportunity. They have a graduate certificate in dyslexia. So I started that 2 years ago, or actually I finished it last year. So it's a 2-year certification program, and you get different classes, and it's all focused on learning disabilities and dyslexia. So I got access to a lot of information regarding dyslexia, and we actually get training in Orton Gillingham too.
Yes.
Yes, I did that over the summer. It was virtual because of COVID, but it was still awesome, and I still learned a lot of things. So I would say that also kind of helped me grow my interests regarding, you know, learning disabilities and dyslexia in particular.
You know, so I think Georgia is actually a pretty progressive state in terms of dyslexia laws. When I was down there 11 years ago, I remember going to IDA conferences for my private school, and I didn't realize just how forward thinking Georgia is in regards to dyslexia laws. And like you said, now it sounds like some of the universities are actually teaching some of the Orton Gillingham methods or certificates. So that's excellent to hear that that's actually what's happening. So what I guess you don't have, do you have your question yet for research? I mean, you're in year 3, so have you?
So I'm in year 3. I'm still, so this semester I will go through my comprehensive exam. So hopefully by next semester I'll advance to candidacy, and then I can propose the question, you know, next semester. But as a general area of interest of mine, and that was kind of my push and my motivation to come here, even to the States, and do research in general, I am interested in creating milestones and kind of literature around children who are culturally and linguistically diverse. So basically bilingual children, speakers of Arabic. As I said, like, we don't have that literature. It makes your life harder as an SLP, or, you know, even the whole team who's working with these folks. If you don't have the literature, there's nothing to really support of course, your clinical findings are very important, and they're a very important base when you're doing work. But you know, you need support of research and science, basically, to know that, to kind of feel more trust that what you're doing is on the right track.
Definitely. So let's switch gears, because I'm really interested, and I'm sure our audience is too. Let's talk about dyslexia, language, all of that in Lebanese schools. What does that look like? So when I ask that, I mean, is dyslexia even in the vocabulary? You know, like, is that something that teachers know? Do they, like, let's open up the floor to that.
Sure, that's a good question. And I'm going to start by saying that it might sound like I'm giving a rant, but that's not what I'm trying to do. What I'm trying to do is just like comparing experiences that I've had, you know, from more of a global perspective now that I've got to practice or see like different settings. And as I said, I acknowledge the difficulties in Lebanon because it's a different context.
Right.
These areas maybe don't have the funding or support that they have here. Different historical context too. So I'm kind of giving that as a pretext before I give like my experiences and opinions on that. As a word, dyslexia, I don't think that we use it as a diagnosis in particular in Lebanon. So I wouldn't say the word. I don't feel from my experience that people feel that they trust that they know it's dyslexia enough to actually use the word. However, I would say like in my practice, I did work with children, but it was more of like, so he has reading difficulties or writing difficulties. So we wouldn't call it dyslexia per se, but SLPs would know it's dyslexia. But I have to say too, so we do not have a law kind of here. You have IDEA and laws that provide these services. And then you need these labels because the child has to qualify for services. So you're having to put this label to be able to provide these services for these children. In the context of Lebanon, you have both public and private schools. And unfortunately, private schools are not funded enough. Public schools, sorry. So they're kind of the underdogs and they don't have that much support. And they're kind of even societally looked at, oh, you're not going to get the best services there. Versus private schools, which vary a lot from one school to another. And they're super expensive too. So the problem is, in general, with these families, they either have to go for, you know, NGOs or other organizations that are providing these services for subsidized money, or then they have to pay huge amounts of money to provide like special education services to their children. Which means though, on the other hand, that the SLP or the special education team decides what services they provide. Which means sometimes, you know, how we speak here in the US that some kids might fall through the cracks because they do not qualify. That's usually not the case, because if you find a need as a SLP or, you know, the special education team, you're going to provide these services, but the parents are paying the cost and the money to get these services. So that's a general system level description.
Well, I think, you know, what's really interesting is I've interviewed a woman who is dyslexic who grew up in Oman, a woman who is dyslexic who grew up in Egypt, a woman who's dyslexic grew up in Ghana. And it does seem like the overall theme is private schools provide a little bit more than what the public schools do. But there's also this understanding, or lack of understanding, that there really is a learning difference. Now, I don't know culturally what it's like in Lebanon, where teachers are strict or call kids stupid, or they have to learn a certain way. I mean, I know I interviewed a woman who's Japanese, and she said dyslexia doesn't even exist in the characters or anything in Japanese, to the point where it's just, especially in Asian cultures, you know, interviewing some folks, they've talked about, you know, there's a set way that you learn, and that's it. And if you don't fit in that box, then there's something wrong with you, and sorry, we can't do anything about it. And so it's just interesting kind of talking to people internationally about what this looks like. So whether it's a lack of understanding, or more so a cultural difference of like, this is how we learn. And if you don't fit in this mold of what is the way to go to be successful, then sorry, you know, SOL. So I don't know. I just find it interesting hearing a little bit about this too. And it just feel like it's like the same thing, just different country, you know, like not necessarily the same, but you know what I mean? It's like you hear these stories over and over, and that's why I have this platform for us to really talk about these things, because this is a global issue. It's not just a US issue or a Ghanaian issue or a Nigerian issue or Australian issue, you know, it's global.
Mm-hmm. I would say though, like from an awareness perspective, there have been some organizations. I know we have like an annual learning disabilities convention that happens in Lebanon.
Mm-hmm.
So they talk about dyslexia, and they bring, you know, people from schools and different therapists and educators together. So I think from a societal perspective, there has been some advancements. I wouldn't say it's something that is not out there, but of course there will be levels of, you know, perception, and I'm sure there are people who are probably still judging depending on the school. But I would say private schools who do have like a special education system, no, they understand that it is our job to provide these services for these children. So the understanding is there, I would say, and the education is there. But the challenges are at the area of research. As I said, you don't have the literature. So the awesome thing here, let's say we talked about the Orton-Gillingham training. People did their literature, you know, their research, you know, someone tried to see, okay, the sequence of teaching these sounds and letters, and then they gave you this curriculum, and then you're able to use it. So for us, we don't have this. This is not there. You have to kind of come up with it on your own. So right. That puts a lot of effort too on the therapists themselves. And sometimes what I felt, even from my experience practicing there before coming here, is that I did like some skills in isolation. I didn't have like a packaged training, you know, like how we talk about structured literacy and going through, you know, building up these foundational skills for children to be able to read. Right. I didn't do that because I wasn't trained how to do that. And I didn't have the resources to do that before, knowing what I know now, you know, so I feel that might be the case for a lot of practicing SLPs and special educators. And so on. So definitely a challenge.
Yeah. And I'm seeing we have some engagement here. So Speech Hero said, I think the lack of education to parents and actually explaining that your kids are not lazy, they just have hardships in certain areas and they need further assistance to help them, and how important the intervention can be. And I absolutely agree with that. I actually have a course that I'm going to be putting out hopefully within the next month. And the whole thing is called Understanding Dyslexia. And so I talk about, I give the definition, you know, it's backed in research. And then I talk about how dyslexia impacts the family, social, emotional, the signs, the early indicators. And then I give practical things for parents and teachers to really know what to do. Because I really do think there's just this lack of awareness. And then Cool SLP had said, I second this, Speech Heroes. Some kids are reprimanded here in Jordan. I'd love to know what's going on in Jordan for not being able to read and write better. And that's the thing. I mean, I feel like, you know, even here in the States, I think, you know, there are the old school teachers who are like, well, I've been doing this since 1998, or I've been doing this since 1983. And it's like, come on, like research, to keep it current, it really should be no more than like 5 to 10 years, and 10 is even pushing it. I don't know, maybe even just 5 to 3 years, but I know there's always not a lot of research in specific fields. Like I know I tried to find some research with Black males that are dyslexic. There's like nothing. Wow. So there's so much that's not talked about. And then also when you talk about teacher training, which I know that's a whole other discussion, that trickles down. So oh, and Ken, thanks Ken for joining. True, this back here in Kenya. Okay, so now we're talking about another country. Dyslexic children are deemed sort of unfit, and this affects their growth and well-being. So yes, and this is exactly why we have these conversations. I'm loving this engagement. This is awesome. Oh, this is a good one. Maybe Miriam, you can answer this. Do you think cultural embarrassment for the parents can have an effect? Like the idea that parents do not want to say that there's something wrong. Yeah, I agree. But I mean, do you want to touch on that in terms of the Lebanese culture? Is that like a forbidden topic?
I would say so. I feel before even practicing as an SLP and like getting in the field, even my perception was like the society is kind of trained to kind of pity people with disabilities, unfortunately. Yes. So if you see someone with disability, you're like, oh, poor this person or whatever. That's kind of the general perception. People, even though they have like the good intention, but at the same time, why are you, you know, patronizing and looking at people like they're just living their life in a different way? Exactly. So I know they have like these good intentions, but the way it comes out is kind of, as I said, like patronizing and, you know, icky. So this cultural aspect can definitely affect parents. And I see that too, especially when you're looking at parents who are still in the early process and they know that something's different in their kid and something's not right. And then they start to kind of, denying it and kind of defending, so that they don't have to accept basically whatever their child has. So I would say, yeah, cultural norms definitely affect that and can definitely influence what parents believe and think. And I wanted to add something based on our earlier conversation too, when you were talking about resources. One interesting thing that I feel that happens in other, like maybe, at least I would say in Lebanon, so that I'm not generalizing, but so since we don't have these research and techniques, and whenever we see, let's say, something from the US, then we're like, whoa, okay, this should be, an evidence-based tool, and I'll use it in my work, and it should, because it's in the US, it's going to be great. And then when you come here, you realize, of course, no, like there's going to be, a variety of material, even teaching reading itself, we know there are two opposing views, structured literacy versus, whole literacy and balanced literacy, whatever the current term is. So even within the US, you can find resources that are either following, either approach. So I would kind of caution whoever, is getting this material, and just because it's from the US or like from an English speaking country doesn't mean automatically this is evidence-based and I can just take it and apply it as is with my clients. Like always try to do some, digging a little further to kind of find out.
No, I agree. It's good to be, and I think given when you get to a place of where we are, where either you're pursuing your terminal degree or you have it, you're at a space and place in your life where you're a critical thinker, but like on times 10, like just because this research is given to you, you still do the research on the research to figure out, is this credible? Is this, actually, does this work in practice and theory and all of that? So I definitely second that for sure. So I wanted to come to our last question, and I was wondering if you, as an SLP, are there 3 pieces of advice or tips that you can provide, whether it's here in the States for people or through the Lebanese culture, like, parents or teachers? What are 3 tips that you could give about dyslexic children, or really just kind of anything that we've talked about?
Sure. Yeah, I kind of thought about this, and I kind of want to give some takeaways that I personally have from my experience with the graduate certificate in dyslexia. So what were my main takeaways and like my main kind of revelations and things that I keep in mind? And these can apply to basically any child in the school system that you're working with. So the first thing that I would start with is context matters. We read the book about the knowledge gap by Natalie Wexler. And this book was really awesome because it highlighted how when we're thinking about language, and we know that in dyslexia, language is important for sure. And a lot of kids with dyslexia can have difficulties with understanding more abstract language, or so if you put whatever you're teaching them in context, this will really help them understand whatever you're teaching them better. So one of the issues she brings up, and she focuses in the book more on American schools and American system, and I think it's really interesting, the history that she brings up. And she kind of talks about the shift, how now the focus on social sciences is less, and then schools are more teaching, reading skills in isolation and taking the time where they used to teach history or, other topics to kind of teach reading. But she's kind of saying that when you're also taking that time and you're not giving that context, so these children are losing that ability to put this vocabulary and this language in this bigger context picture. So I would always remind, like, whoever's working with these kids, like, always bring the context. And this kind of leads me to the second point, which is like work closely with teachers and the special education team. So one great thing that you can do is look at the themes that the children are going through in social sciences and history and whatever, just sciences in general. And you can always integrate that through whatever support you're giving them as an SLP or special education teacher or whoever. So bringing that context in will really help them learn this. You'll be just like going full circle, you're working on this strategy in isolation, but you're bringing the topic that they know about. So you're not making it hard for them to come up with this writing text when they're coming up with something that they haven't heard of, or,
right.
you know, we ask children a lot to write about your, you know, summer break or write about something. But if you ask them about the science topic that they learned in class yesterday, they have a lot, you know, they came up with these vocabulary terms that the teacher talked about, and they know this content better. So they're able to write better about it, of course, because they know it. So bring the context in, and you can do that by collaborating with the teachers. Keep that close contact. Teachers can see a lot and early on too. So if you keep that close contact with them, I know in Lebanon we don't have universal screening for children with dyslexia, but that's something you can do too. You know, you can kind of walk into the teacher's classroom. I know we can, like in Lebanon. So ask her, like, are you seeing any reading concerns with any of your kids? So keeping that close collaboration, I feel, can be very beneficial to both, you know, you and the teacher and the whole team. One last thing I wanted to also kind of touch on was to also not forget to teach writing skills. And you can start as early as possible with these kids. Another resource that I'd recommend for that is The Writing Revolution. I don't know if you've seen that book. It's really awesome. It talks about kind of writing strategies that you can include with your students. And it's kind of like a whole curriculum too that you can follow. It also focuses on context for sure. And the thing is, like, even teachers in the classroom, they can use reading and writing strategies. So you can, a science teacher or a math teacher or social sciences teacher can include writing within their classroom too. And that's a good way for them to test their students' knowledge of the content that they're teaching. So this close collaboration can be done. Like, you can kind of suggest that idea to the teacher. And if you give them the book, The Writing Revolution, kind of lays out some strategies that you can do. So that could be a nice way to kind of, as I said, like, you're going through the content, but in different ways. So the children, they're understanding whatever you're trying to teach them, but you're kind of targeting it through reading and then writing here. You're filling any knowledge gaps that they're having. So
I love that.
These are, three main takeaways that I
So you said context, kind of utilizing the team to bring in that context, and teaching writing. Before we sign off, I actually wanted to comment on the screeners. So I actually, so those of you who may not know, I have a digital product store. You can find the link in my bio. And so what I'm doing is I'm creating resources based on things that people, I feel like they need, based on conversations I've had. So I want to definitely say I have created, based on some research and things, 3 different kinds of screeners. There's a dyslexia screener, a dyscalculia screener, and a dysgraphia screener. But please know that that is not a diagnostic tool. It is just a screener. So if you pull up this, dyslexia screener, and I don't know how many checkboxes are on there, let's say it's 30, and a child is exhibiting 25 of them, that's a good indicator to say, let me go to the team. Let me talk to a special educator, and then kind of move the process along. But it's a good foot in the door to kind of get your mind going. So definitely wanted to kind of plug that and let everyone know that I have resources that are out there that can be used as well. So Miriam, I'm very excited to have had this conversation. I think it's been very fruitful. It seems like this was very helpful for our audience and anyone who is viewing this later. So I wish you the best of luck with your doctorate program, and soon we can call you doctor.
2 years from now, hopefully. So. I really enjoyed this conversation too. Thanks for having me. And I feel like this is a topic that I can go on and on about. So this was really interesting and exciting for me. So thank you so much.
Yes, thank you.